name is Jessica, and we're here today to talk about the laser medical aesthetics. We use the Luminous One system. Our objectives for the lecture are to promote patient compliance and to optimize treatment, to provide information regarding the benefits and safety of medical aesthetics and laser treatment, and to reduce anxiety associated with the procedures themselves. This is the Luminous One system. It has 3 different heads. The first one that we're going to talk about is for laser hair removal. It's the Lightsheer. Next is the IPL. The IPL has a larger head. You can change the wavelength here. And the IPL is used for more medical benefits than the Lightsheer or the YAG, the last one that we'll talk about. The IPL will help take care of rosacea, of acne. It will help reduce fine wrinkles. It'll help kind of tighten the skin. Any photo damage, sun, and things like that can be taken care of with the IPL. Lastly is the YAG laser. The YAG is specifically for spider veins. One of the things that most people have concerns about before their laser treatment is pain control. Some people have more pain than others, and so we kind of assess the patient as we go and determine what is best for you. Each of the heads has a chilled tip. It's like frozen, so that will help with some of the pain. If that doesn't help with the pain like it should be, then we can do a topical anesthetic, which is benzocaine, lidocaine, and tetracaine. You'll come in earlier than your scheduled appointment. You'll apply it, leave it on, and that will kind of help reduce the pain. If both the chill tip, ice, and the BLT cream don't help with pain control, then the physician will prescribe pain medications or anti-anxiety medications to kind of help. One of the major concerns, aside from pain control, is safety with the use of the laser. The laser must be owned by a physician. It's one of the laws in the state of Arkansas where we are. And so under the physician's control and under their medical license, anyone who has another medical license, an RN, an APN, can perform these medical treatments. The major thing with any of the 3 treatments that we offer is sun exposure, and that's very important for healthy skin habits anyway. Most research says not to stay out in the sun during midday hours, to use at least 15 SPF. We recommend a 30, especially during treatment. And if you do have to be out in the sun, if you work in the garden or if you enjoy the lake, using a higher SPF and keeping covered as often as you can is very important, especially during these treatments. Tanning beds are not allowed at all if you're having any of the 3 treatments. Another thing as far as safety goes is your medical history, any medications that you're on. Whenever you come in for your consultation, the physician will go over all of those things with you. The medications that you can't be on whenever you have a medical laser treatment are antibiotics that cause sun sensitivity because you can burn easily. And blood thinners sometimes are not good for like the YAG or the IPL, not so much for the hair removal. Another big thing in a lot of our clients is their medical history as far as cold sores. If someone has a hormonal imbalance and they're having their facial hair removed by the Lightsheer, sometimes the energy and the wavelength in the Lightsheer can kind of exacerbate some inflammatory response that will cause a cold sore. So if you have a previous history of a cold sore, we'll prescribe antivirals and get that treated so that we can prevent it before it will happen. Another thing that he'll go over with you, the physician, is your current treatment method. Most people that come in for the IPL, especially in this community surrounded by lakes, they come in because they have photo damaged skin, so they've been out in the sun for a long time and they'll have little sunspots. Any skin lesion that you come in to be treated with the IPL must be seen by the physician, and he has to assess and diagnose you with whatever skin lesion it is that you have. If it's a sunspot, an age spot, if it's rosacea, if it's acne, or if you're even just getting your fine lines and wrinkles in your face taken care of with photorejuvenation. The physician will see you. If he suspects that there's any irregularities in your skin lesion, then he'll recommend that you consult a dermatologist of your choice before you come back in for your laser treatment, because the laser doesn't biopsy things that look abnormal. It just tries to kind of get rid of them. And so it's very important, health-wise, to get those taken care of. If you're cleared by the dermatologist, whether you had to have a biopsy or he just looked at you and said it's okay, then the physician will go ahead with the okay. As far as the IPL, the major thing with the IPL is to make sure that you wear sunscreen during treatment. And most skin lesions, whenever he initially treats them, will become a little bit more dark. They will eventually kind of crust and flake off. Treatments are done monthly for the IPL. It's very important to moisturize during treatment, and again, sunscreen. Any of the skin lesions that you're thinking about having treated with the IPL, you should kind of assess yourself. The ABCD rule is very important whether you're having the laser therapy or not. Watching for asymmetry, border, color, diameter changes, things like that are all very, very, very important. And if you pick up on any of those changes in the past 6 months or so, year, and you want to have that lesion taken care of, talking with the physician and explaining the changes that you've seen is very important. The next one is the Lightsheer for the hair removal. Really, the medical benefits for the hair removal mostly have to do with the hormonal changes, imbalances, things like that. It's, again, very important to stay out of the sun, to use sunscreen, and to moisturize. Pain control is the same as the rest, either the topical, ice with the chill tip, or oral medications. Whenever someone comes in for hair removal, depending on what area of the body the hair removal is taken away, we'll recommend probably 6 to 8 treatments. Whenever someone comes in and they have their first initial treatment, they should expect a 10 to 15% reduction. And after that, they'll see the perifollicular edema, which is what we want. It means that there's an inflammatory process because the hair at the root is actually killed. Sunscreen, again, is very important. No heavy sun exposure, no tanning beds, and moisturize. The YAG for spider veins is done probably less frequently than the others, because most of the spider veins, whenever people come in, they're not actually spider veins, they're palpable. So anything that you can feel, if you run your finger across the vein and you can feel a raise in the skin, that means that we can't treat it with the laser. You'll have to go to a vascular surgeon. And the physician or I will be glad to do a consultation with you to determine whether we can help you with your spider veins or if you need a higher level of care, basically. So, with the spider vein therapy, only veins that look like that they've been marked on the skin with a pin, and stay out of the sun and moisturize again. Right after your treatment, for the next 6 hours after your treatment, no heavy exercise is recommended. For all of these treatments, compliance is the most important thing. A, for your safety, and B, for your maximum benefit of any of the therapies. The process for having a medical laser aesthetic treatment is to speak with a physician or a consultant of the physician to determine what you want to get taken care of, what would be best for you, to go over your medical history, your medications. After you speak with a physician, he finds out about your medical history, you make an appointment. The most important things are to stay out of the sun, to use lots of sunscreen if you are in the sun, to moisturize as much as you can. If you're doing hair removal, to make sure that you're not taking the hair out by the root, plucking or waxing, things like that. And then as far as the spider veins, staying out of the sun mainly. Moisturizing is another. And making sure that you don't have any perfusion issues. So consent, consult with a physician, pain control, and compliance are all what we've covered today. If there's any questions, just let me know. Thank you.